Good morning, guys. I hope we're all sparkly. I've said the phrase, it's just a little prick, over 1,000 times. Mostly at work. Sometimes as an apology. No, I'm joking. Always at work. So, why have I said this phrase over 1,000 times? It's a bit of a flippant phrase, isn't it? Well, it's applied to a situation that a lot of you build up and build up and build up. And you have a lot of anxiety about your first injection, not realizing it is essentially painless. No joke. Administering a 29 gauge insulin needle into your subcutaneous fat is essentially painless. Now, it might cause a little prick. It might cause a spot of blood as if you pierce a capillary, but 99 times out of 100, it is painless. So, suck it up, buttercup. It is no big deal. Honestly, no big deal. So I say this phrase, it's just a little prick afterwards, because you can see the relief in their faces. I can tell you it's painless, but you have to believe it's painless. And sometimes the only way of doing that is by doing the injection. Hence, I make this trivial joke. It's just a little prick. Now, the fear of needles is real. It's a rational fear. Somebody's coming at you with something that is going to hurt you. You are administering an injection that is going to hurt you. Well, honestly, I would say it's all in this. However, your brain is more sophisticated than your consciousness. So if you understand the polyvagal theory, you'll understand that sometimes your autonomic nervous system has a mind of its own. You've got sympathetic fight or flight, parasympathetic rest, relaxation, social engagement, and the dorsal vagal part of your autonomic nervous system. Now, this is the reason why people faint. It's the reason for a lot of other things, but we'll talk about fainting, because essentially your body is going into this tonic immobility state that in nature is protective. You are facing certain death. You are a gazelle in the grips of a lion. There is no escape. What should you do? Well, there's no escape. So you should relax. You should conserve your energy for the opportunity, potential to escape. Perhaps if the lion gets distracted or it gets delivered to the cubs and the cubs get distracted, you have the potential to escape. So there's no point expending energy when you are facing certain death. However, this wonderful survival mechanism gives you the opportunity to escape if the opportunity arises. So if you translate this into injections, somebody's coming at you with a needle, or you've got a needle, and you're about to pierce yourself. This does not seem right. This does not seem right, even though, obviously, that person coming towards you with the needle is drawing bloods or going to give you an injection to help you. But your basic brain, sorry guys, your basic brain cannot understand this, and it goes into this dorsal vagal part of the nervous system and you faint. I've had patients faint when they take blood and on the first injection. Oh my word, what are we going to do with you? Well, because it's all this, we have a little talk. Because if you take control, if you can rationalize it, understand it, conceptualize it, you can conquer your fears. Now, I do have one guy who I won't name, does pass out every time I take bloods. However, he is still a massive proponent of daily injections because he sees and feels the benefits of the therapy that we're administering. However, he can't get over the needle coming towards him. This time, he managed to not pass out for 2 minutes. Now, we laugh about it because, listen, it's fine. It is what it is. So when I say it's just a little prick, it might sound trivial, but it really is just a little prick. As much as I want to tell you, don't worry, you will worry. But after I administer the first injection, demonstrating safe and effective technique, I'll say these words, it's just a little prick, and you will giggle. Everybody giggles because it's stupid, and we like a bit of stupidity.